André, I was wondering if you could speak a little bit to going beyond just the sadness and the psychological effects of being excluded or lonely or disconnected. Laura touched a little bit on some of the health impacts. Why and how does social isolation lead to poor health outcomes?
Well, I think there's a number of reasons. There's the social aspect, the poverty, et cetera, and it kind of feeds into it. From the more medical, physiological side, I think what's been studied and what we know is that isolation is essentially a form of stress, and we talk a lot about the impact of stress on your body. And what it does is, not to be too technical about it, but it's an inflammatory reaction. So when you have inflammation in your body, it's bad for you. It's bad for your heart. It's a trigger for cancer. So inflammation is sort of a response of the body to a stressor. So that's the technical reason. So we see people who are socially isolated have much higher rates of heart disease for that reason. Stress is a big factor in heart disease. Lots of evidence that dementia is worsened by this or can be triggered by this. Now, these are all complex interactions, so we don't know exactly. People with who are lonely have much higher rates of diabetes, which is another inflammatory disease of the body, etc. So that we have really good evidence of what the impact is physiologically. The mental health aspect is one of those chicken and egg things. People with mental health issues tend to be isolated. That makes their physical health worse, and vice versa. If you're isolated, your mental health becomes much worse because it can be a trigger for depression, etc. So there's a lot of complex medical factors here beyond the social ones and the economic ones, which Laura touched on very well.
When I was doing my graduate work, I was at U of T, and I was working here in Toronto in inner suburban neighborhoods and working with communities, a lot of them living in high-rise towers in Toronto. And I was particularly interested in looking at access to food and access to healthcare for new immigrant families, particularly ones with young children. And so I worked with various community organizations to find different women to speak with, and we'd go, as a research team, we'd go and speak with them in their homes. And so one of the things I was interested in was how socially connected these women were. And to be perfectly honest, we went in with some assumptions, right? We went in assuming, even at just a pretty base level, we thought that what we were going to find was that, in any one given, tower or, set of towers, especially ones with a high density of people coming from the same countries, speaking the same language, that there would be at least some level of social connection. But what we found was really striking, that this was definitely not always the case. We would, be interviewing women, in their apartments and asking, do you know anyone in your building? Do you have any friends in your building? And they would say no, they're new to Canada, they don't have friends and family around, and they're spending their days alone, right? They don't have access to childcare, it's totally unaffordable in Canada, so they're alone. So we'd have this conversation, and then we'd go literally 4 doors down and have the same conversation with another person who shares all of these characteristics, right? Which, lots of us don't know our neighbors, but it was just a particular moment that really helped us to realize how complex it is, right? There's a range of social and cultural, economic factors which are going to play into it, and we've seen in some of our work with the Wellesley Institute, we've done work in St. Jamestown, which is another high-rise community in Toronto, and found that there's just a range, right? For some people, there's a phenomenal community there, right? And so the question is why for some people, and whereas others can really experience these high levels of social isolation.
I think for me it was many years ago. I was writing about disabilities. I read about healthcare, and I read a lot about people with disabilities, and stumbled upon this group called Planned Lifetime Advocacy Network, a wonderful network of parents who had children, elderly parents who had adult children with Down syndrome mostly, And their whole thing was they were unhappy with the social services network. They found that what they got was services, but they didn't really get a life. So their whole thing was building what they called a circle of caring around people. So they could remain in the community, so they could have jobs, so they could have friends. And they really impressed upon me that, you know, what matters to them was not the income, wasn't getting this particular welfare program. It was actually being part of a community and having friends and having neighbors. And to me, that really drove it home, that story. Many years ago, it must have been in the late 80s that I wrote that. And then that was reinforced to me when my kids were young. We would take them around doing sort of a Meals on Wheels in Montreal, where I live, called Centre Paul Roulant. We bring hot meals to people. And what I realized, because my daughter then was about 4, my youngest. She was very, very sociable, and she loved doing this. And I soon realized that what mattered to the people wasn't so much the food, it was actually people visiting them to bring the food. And she would spend time with them, and she'd sing, and she was very outgoing. And that really struck me too, that, you know, what really mattered was these connections, bringing people back out into the world who, a lot of these people never left their apartments, you realized when you brought them food. So I think those two things kind of overlapped, and it's always been there in the back of my mind when I write about healthcare, and I often write about it from the perspective of social determinants of health rather than medicine, because I write more about policy than medicine.